Good morning, good afternoon, good evening, wherever you are. I am Johannes Kieding, for those of you that haven't met me before. I see some new faces, but also some familiar ones, which is so nice. So under the rubric of ISTDP, obviously, I'm envisioning two main themes rising to the top today and taking center stage. They are pressure and challenge, and the needed foundation for pressure and challenge, and character change. So I'm guessing most of you know that pressure and challenge are defining features of ISTDP, and they can be incredibly healing and powerful. The issue of it is this, that a lot of people that are trying to do this end up dragging their patients through their defenses and through their feelings in a way that is draining, exhausting, and actually aggravating for everyone, including the therapist. And you can do that, and you can get lucky and have some unlockings, but it's actually not clear to me how therapeutic those unlockings really are, and obviously the chance of a misalliance is exceedingly high. Okay? So the alternative is to make sure you have a proper foundation. And that foundation consists of ensuring that you have a collaborator in your patient. That means you and your patient are on the same page. You're pulling in the same direction. So here, the patient, first of all, they can see their defenses. Not much is going to happen unless they can see their defenses. Then they have to see that their defenses perpetuate their presenting problems. And it's not enough for you to see that. The patient really has to see that. And then the patient has to see that even though their defenses at one point in their life was probably a lifesaver, at this point they have really become a destructive force in their life, and they don't want to do them anymore. So again, it's not enough for you to see all of that and for you to want that for the patient. The patient has to see that. The patient has to want that. And then lastly, the patient has to see that the way to go is to experience their repressed emotions, that that's their ticket to freedom from the mess that their defenses creates in their life. Okay? So all that has to be in place. Now, how you get that into place and the time frame for getting that into place, it varies from person to person. It could happen within the first 5 minutes of the first session, or it could be several sessions down the road. But however long it takes is how long it takes. Okay? So in a few minutes, I'll talk about character change, but very briefly, let me just foreshadow what's going to happen here very soon as we really delve in and get started. For those of you that may not have a clear sense for what pressure and challenge really looks like and sounds like, maybe some of you that are newer to ISTDP, I'm going to show a 10-minute vignette from the initial 3-hour session. I think it starts like maybe at 40 minutes into the session. So we'll watch that 10 minutes and then we'll call it a day, and that'll be it. Just kidding. No. So we'll watch that 10 minutes, and so you get a flavor for what pressure and challenge looks like, for those of you that aren't sure. And then we'll go to the very, very beginning, right, minute 1 of the initial session. And I'll show you how we got there, to where I begin to sort of slowly ramp up with some pressure and challenge. And then we'll watch that vignette again, and then the rest of the entire course of treatment moving forward with this perspective in mind. Okay? So that's going to happen very shortly. But first, just a few more words on this thing about character change. So, very briefly, in terms of ISTDP metapsychology, there's the breaking of a bond between the child and the parent, or a violation or fracture of the bond at least, due to abuse or neglect or misattunement or what have you. And then that unleashes a cascade of internal reactions. There's the pain of the trauma, then there's the reactive sadism, the guilt, and so on. And then there's repression, because typically it's far too overwhelming and scary and difficult for a child to face those sort of feelings towards people that they love and depend on for survival. So there's repression, and that repression tends to be recurrent and repeated, because what's going on in the environment tends to be recurrent and repeated. So there's this continuous fracturing or injury to the bond of trust and affection between child and parent or caretaker. Okay? So eventually this repression solidifies. And it's the solidified repression that has been termed our character armor. Okay? It's what we do to keep a distance from other people and from our inner life, our own innermost feelings and thoughts. So character change means that we reverse this process. So we help the adult patient in front of us experience what they could not experience when they were a child. And when we do this, it's not like you become unrecognizable or anything. You're still you. In fact, your inherent personality, your innate temperament actually becomes more liberated. So you, in one sense, you become more recognizable. But it's the destructive part of your character or your personality based on repression and self-punishment. That's what takes a back seat. Okay? All right, enough of my little preamble. Any comments or questions before we delve in and actually start watching this case? Well, he needs to see the consequences of maintaining his defenses. Like, unless he's turning against them, we're pretty dead in the water. So, but what you'll see eventually is that right now, and that's important, the kind of pressure and challenge I'm doing right now is not towards an unlocking. And you'll see what I'm actually trying to get at eventually. But this kind of pressure and challenge is meant to loosen up his psychic system enough so that we can have a kind of experience that he needs to have before I can really ramp up the pressure and challenge towards an unlocking of the unconscious. So this is kind of a gentle form of pressure and challenge, but I'm not actually driving towards an unlocking, and it will soon become clear to you why. Okay?
Is that okay with you?
Is that okay with you? There's a couple of things that does. It undoes defiance because it makes it about him and what he wants. And secondly, it underscores that this is about what he wants. So undoing defiance and really focusing on his will. Okay?
Johannes, I have a question.
Sure.
We can't see it, but I'm just wondering, is he teary right now?
There is some tearfulness, but he's also sighing. So I'm not concerned about regressive weepiness because he's nicely firmed up. Like he's nicely firmed up. His hands, there's a lot of striated muscular tension. And there is some tearfulness, but honestly, I'm reading it more as emotional pain that he's consciously trying to suppress. So it isn't quite, that's my read on it, but we'll see what you think as we watch further.
And can I ask a question?
Mm-hmm.
I noticed that you were the one to mention anger, I think, not him.
Mm-hmm.
I mean, as long as he's sighing, is it feeling okay to be sort of leading him in that way, or?
Yeah, I felt okay about it because he was talking about how unfair it was. And Davinlu did that sometimes. He would put those words in the patient's mouth, but then I looked at his response, and he said, "Is it fair to say you hate it?" And he took a big sigh and he goes, "Yes," very emphatically. Okay, so it's convincing. He's with me. I'm not, it doesn't seem like conjecture. But in other contexts, I would be much more concerned about doing that. In this context, I'm not concerned about it.
Okay.
But then let's see right now, this is the moment of truth. You say, what are you prepared to do? What are you going to do right now about this need to cripple yourself? Paralyze you?
Another sigh. You see how we don't have to worry about regressive weepiness. There's striated signaling. So this is a very significant communication from the Unconscious Therapeutic Alliance. He's pointing to what his core conflict is. And this wasn't the first time in the session that he does that, but you can hear he's saying, I'm terrified of losing control and being like my mom. You'll get that, or you'll see that eventually. His mom was very aggressive and acted out a lot. So he's beautifully letting me know this is my core conflict. What else could I ask for? So he's starting to sort of more and more see the destructive nature of his defenses, how destructive it's really been for him, which is a major component of helping him turn against those defenses. Like the patient really has to see this is a killer for his therapy, for his life. Again, you see his core conflict. It's not clear to him that there's an alternative other than either repression or acting out. And it'll become more clear to you as we go, and as I rewind the tape to the very, very beginning, it'll become clear what's really going on here. But part of what will be clarified is that I'm actually not driving towards an unlocking of the unconscious. I'm driving towards another experience that's a prerequisite. And so hang tight, and things will become clear. Okay, this is an important thing. So he has the urge to yell at me. A lot of people would go, oh, well, that's discharge. It's discharge if he yells. You see this in some of Davin Liu's transcripts. The patient reports the urge to yell, and Davin Liu capitalizes on it as the beginning of the sadistic impulse, the urge to be hurtful. So it's only discharge if there's actual yelling. The urge to yell is the very beginning. It's the mild form of the sadism. It's an important point of understanding. Always, always. Is this what you want? Is this what you want? Always the focus on his will.
Do because the wall is there. You hold it back.
Okay, so we went from 35 to 46. So we went for 11 minutes. And so this, for those of you that may not have been clear on pressure and challenge, this gives you a flavor of what we mean by pressure and challenge in ISTDP. But keep in mind, I was actually not driving towards an unlocking. You'll see that in the 12th session, you'll see what that looks like. And that's a far more unremitting pressure and challenge. Much more unremitting. Okay? Because I had a different goal in mind, it's not what I did. Any questions and comments before I take us back to minute 1 of this very initial session?
Yeah, I'm sorry, I didn't get what you would do now differently.
Oh, remember how he said, I feel like I'm being difficult?
Yeah.
The patient said, I feel like I'm being difficult, right? Right.
Difficult for you as a therapist.
Yes.
Oh, I see. Okay.
Right, which, probably points to some sort of compliance defiance type thing.
Yes.
Right, but...
I was going to say, I didn't, like, in that moment when he said I'm being difficult, I didn't feel like he was being compliant, so he was trying to go along with you. I felt he was feeling himself that he's starting to become defiant.
Yeah.
So it was kind of like a mismatch right there, and I kind of noticed that. But then you said you made a mistake, and I was like, oh, okay.
Yeah, excellent observation. Compliance is really defiance in disguise. So,
okay.
but you're absolutely right. That's a beautiful observation. So, very good. So let's go back now.
Wow. So what would you do? I didn't get that.
Oh, I would have just said, can you elaborate? What do you mean you feel like you're being difficult? I mean, I was jumping to a conclusion, but I could have just asked him what he meant.
I see. Okay, so what you would do now differently? It's not to assume the meaning of what he said. I see.
Yes.
Okay. Thank
There
you.
was no need for me to assume that. I could have just said, "What do you mean?
Yeah.
Can you elaborate?"
Yeah. And it would be less tiring for you too.
Yes,
Yeah.
and less presumptuous, and so good. We'll learn from my mistakes. That's wonderful.
I just want to say one thing. I'm noticing, like, as you're talking to him and challenging and offering pressures, in some ways it sounds like you're really speaking to his unconscious in this, like, sort of low-tone commentary.
Yeah, a lot of the interventions, that's how Davin Liu described it, they're designed to speak to the unconscious. This thing about the crippled man. Now you move to the crippled man position. You're not a crippled man. It's all designed to speak to the unconscious, to help the... I guess he discovered that as he was watching his own tapes for, years and years. He would interview people afterwards, and they would fill him in on what was really going on. I was fooling you at this point, and here's what was happening here. And they all said that the word crippled really resonated very, very deeply. So he started sort of using that as part of his nomenclature. Anyway, thank you. Thank you for that observation. All right. Let's go to the start. Ding, ding, ding. So the alarm bell should be going off. He's communicating a majorly important dynamic. this thing about feeling like he has to choose between mom and dad. It creates such damage to the human psyche. And so he's not answering the question directly, but he's conveying very important information. So I'm going with that rather than being rigid about, well, you didn't actually answer the question. I have 3 hours with this guy. We'll get to that. No rush. This is part of the dynamic inquiry phase. I'm someone who doesn't like to skimp on it. I think it's extremely important. And so I'm finding out about him. I'm getting to know him. And I'm establishing myself as a figure in his life that he would want to open up to. Okay? Like that's important. Like, why open up to someone who doesn't know anything about me? That's a reasonable concern that some patients have. And so part of what's going on is I'm gathering important information, and I'm establishing myself as someone he would even want to open up to. So the sub-communication is, I have a lot of unresolved feelings about things that went down in my childhood. Right? It's clear as day. That's what he's saying. I have a lot of unresolved feelings. This is the kind of stuff that went down.
Johannes,
Mm-hmm.
so right here at the beginning, you're much more concerned about forming a conscious therapeutic alliance, right?
I am.
So you're not focusing on communicating to the unconscious right at the top, right? Because obviously if you don't have a conscious therapeutic alliance, you're not going to have anything.
Yeah, his unconscious is communicating to me, is how I'm reading it. I'm not going to interfere with that process. He's sharing extremely psychodynamically rich, relevant information. Why would I interfere with that? I'm not going to engage in pressure and challenge to mobilize his feelings until there's a clear therapeutic contract of what the therapeutic task is really about.
Oh, okay, right, because he hasn't declared yet specifically, got it, right?
Well, he's declared some problems, but we're understanding the nature of them, and the therapeutic task hasn't been clarified. Unless he's clear on the task.
You really have no right to start getting pressure and challenge.
This is true. This is true.
Johannes, regarding to kind of piggyback right on her question about like you speaking to his unconscious, isn't it true that no matter what phase you're at or where you're talking, that the unconscious can speak to you like the whispers from the unconscious? And it's not that you're pressing for it, but it will happen because he has the internal conflict going on, and the unconscious will kind of come through. And you're making critical assessments where now you're just making connections based on what he's saying.
Yeah, right? I really agree with that. Sometimes pressure is what mobilizes the unconscious therapeutic alliance. Sometimes it's doing a good inquiry. It's, we don't want to be too rigid or formulaic, but whatever seems to be furthering the flow of these important communications, that's what I'm going to go with.
Okay.
See, I bring it back. We were talking about examples of withdrawing, and he shared all of this, and so I'm asking him, I'm assuming there's a link here between what happened with your father and his rejection at the hands of your father and your tendency to withdraw. So it's okay. You find your way back. You don't have to be too rigid. You can give him some leash and get some mileage, okay? Major communication. I condemn myself to my father's way of life. That's the unconscious speaking. There's not yet a clear contract around facing the depths of these feelings, so I'm not pressuring it. There's no rush. It's very important to understand. This is all triangle of person work, by the way. There's 2 triangles, right? Triangle of conflict, triangle of person. The triangle of person is less sexy, but it's so important. It often takes a back seat, and everyone is mainly focused on the triangle of conflict, but you don't want to do that. The triangle of person is very, very important. Looks like these feelings go back a long way. That's me pinging the unconscious, the past, the P on the triangle of person, right? This goes back a long way. There's a lot more where this is coming from. You see how I'm underscoring the cost of the defenses. You're bottling up, it looks very painful, but I'm doing it in an empathetic way. There's no pressure and challenge, but I'm still communicating to him, these defenses are creating a lot of pain for you. So you can get a lot of therapeutic mileage. Pressure and challenge is important, but it isn't be-all, end-all, okay? Okay. Part of me coming here is I don't want to push back my emotions. So this is coming from him now, that's when it's most powerful. And he himself declares, I'm coming here because I don't want to push back my feelings anymore. Okay? It's coming from him, not me, not from me badgering him. It's coming from him. Do you see how clear he was on that? That isolating and withdrawing is a function of bottling up feelings. This is critical for really cementing that intrapsychic focus. So now he can be motivated to face his feeling. I mean, even more motivated than he already is. It's important to really help him see that over and over. This is 10 minutes into the initial session. He said, I know you asked for an example, but I want to set some context. If I were to insist on, well, no, let's just get to the example, that would be the big, you would see the misalliance there. He's saying he wants to set some context. We're 10 minutes in. It's okay. I'm not going to lock horns with him about, well, that's not, that doesn't answer the question. I realized that there was too much feeling in the moment. He's mobilized. And so to start talking about examples outside of the the here and now with me, it was off. So it was happening live. He's pushing back his feelings in real time. Bringing this into bold relief, this internal conflict around the UTA, the healthy part of him that wants to heal and face his feelings, and the resistance part. It's critical, so he can really have clarity. Here's what's really going on inside of me. You want to bring it into bold relief. It's beautiful. He's helping me understand what he's conflicted about. So think about the misalliance that would happen if I just pressured without first fully understanding his conflict. You want to understand the conflict before you just apply pressure and challenge. And so he's choked up. I hope everybody can hear that. He's really choked up. Like when he talks about, well, the reason is, it's not just a defense of rationalizing. He's explaining to me something highly important and relevant. He's choked up. There's a lot of feeling. So if I were to say, well, let's not rationalize, it would be a major misalliance. Therefore, I have to help him see the differentiation between feelings and acting out, the defense of acting out. This is telling me that in his mind, the corners of the triangle of conflict, feeling and impulse, anxiety, defense, are not clear. They need to be differentiated. And this was the email. I hope all of you saw that email where I cited Davenlu as saying that when the patient is not clear on the distinction between the feelings and impulses, anxiety and defense, if you ramp up pressure and challenge, you only get a misalliance. So he's not clear on that distinction. Therefore, to pressure and challenge is not the way to go. I mean, at least in terms of unremitting pressure and challenge. A little bit, you'll see. We'll see. Enough said. Let's just watch.
Look at some instances where you lost control, so I can understand more where this fear is coming from.
All right, so now I'm heading down the path of looking at an example so we can begin to differentiate feeling from anxiety and defense. Like that's the therapeutic task at this point, right? Because the road to the unconscious is blocked. As long as he's thinking, facing my feelings means I'm going to lash out and be like my mom. So that's the therapeutic task. Nothing very, very productive is going to happen until we achieve this differentiation on the triangle of conflict. Okay? Just so all of you know. Salvatore?
Yeah, can I say a comment?
Of course.
Yeah, I can clearly see how if you would have rushed into pressure and challenge, he would have perceived you as somebody that wanna make him like his mother.
Yes. Spot on. You get a gold star. Excellent. Absolutely agree with you. Any other questions or comments? Okay.
Well, there must be a difference between acting out and because in the last sentence I felt like, he does see the difference, but that's not enough for you too, because
right, great.
how much of that do you need to?
Yeah, great.
Not,
yeah, excellent comment. It's not enough. He needs to actually experience. He needs an experiential reference point. The cognitive understanding, like, there's a difference, it's good, it's helpful, but it's not enough. And so I'm trying to facilitate an actual experience.
Okay.
where he can experientially go, oh yeah, this is a different thing. This feels better. I want to do this. I want to really face this. Okay?
Okay, because there are people, they don't even know cognitively that there's a difference. So that's like, but you say they need to experience the difference to be able to go to the breakthrough.
Both. There needs to be a
Both.
cognitive understanding, which I agree.
Sure.
I agree with you. That's important, but it's not enough. And you'll see.
Okay.
You'll see how this goes. Okay. Thank you so much for all of you for your comments. It's great. There it is. It would have been a misalliance if I had pressured. He sees it as the better alternative. So this is to your point, Anya. So here's the cognitive differentiation, just explaining to him, and that's important. But in my world, it's not enough. And so you'll see. Do you hear how decisive he was when he said, yes, does that appeal to you? Yes. That's what you're looking for in terms of the conscious will, the conscious alliance. You're looking for no equivocation whatsoever. Firmly, yes, this is what I want. All right. Well, let's get after it then. So, there's now, like Anya was saying, she made that point about having cognitive clarity, about the differentiation between feelings and anxiety and defense. That's now in place. And I've made some interpretations that have landed. So the resistance is softening a bit, but it's still there. And so now you're going to see just what you saw at the very beginning, the first 10 minutes. You'll see me ramping up with some pressure and challenge. But now you know why I'm not going for an unlocking, why I'm not being more unremitting, because I'm still going for that experiential differentiation. And once we get it, I'll say, here's what I was after all along. And you'll see that, okay? So with this perspective in mind, let's take a look at this. Yeah.
Okay.
Yeah, Davenlu did that in his later years. He would just say, if I was your dad and you looked me in the eye, let's see how you feel towards me.
Okay. Yeah. So it's just a different way.
Yeah. Right.
Yeah.
Right.
All right.
Right. But then you want to differentiate yourself again afterwards and go, well, you see that I'm not your mom. You want to make sure you have that differentiation. But yes, this is something that Davenlu did. Up to this point, it has been. He's fobbing me off. It's a tactical defense. But what about now? So Tamara, at this point, the wall is fully formed. So now I talk about the crippled man and what are you going to do about, because he's saying he doesn't want to do that. So now there's really a wall. Okay? Mini head-on collision. Just pointing out reality. You keep doing this, we're not going to make progress. It's just reality.
You look away. How do you feel towards me right now? If you're told.
So he looked away. The first sign of gaze avoidance, I know he's avoiding feelings towards me, and I go for feelings. But up to then, I just stay with the defenses. That's how, if you look at Davenlu's transcripts and work, that's what he did, mainly. There was asking about feelings, but a lot of it is just staying right on the defenses. Sometimes when you ask about feelings prematurely, it just gives the patient something to intellectualize about. Oh, I feel this, I feel this. So a lot of times you just want to stay with the defenses, and you ask about the feelings right at the right time.
But it's also taught differently from different teachers how to manage that. I see that now. So
yeah, how right?
So you ask for feelings towards you only when he starts to look away.
Well, if you look at the session up until now, there were times when I asked about his feelings and your state of mind. Are you having feelings towards me? So I did it in a casual way without pressure. So, but yeah, in terms of in a pressuring manner, yes, I waited until now. Okay. And how right you are. Different teachers do it different ways. There's different flavors of ISTDP. You're absolutely right.
So it wouldn't have worked there because at that point he hadn't built any type of conscious alliance with you, right?
Yeah, and there also wasn't a high enough of a rise of the complex feelings. So now there's,
And here there's the mixed feelings are rising.
Right.
That's where you took that opportunity, right?
Yeah, you got it.
It just seemed like that might have been when he said difficult defiance. Well, I guess it's always the flip side of it anyway. So.
No, you're right. You're right. And had I done it now, I wouldn't have made this assumption about compliance. I would have just maybe asked him to elaborate on it.
I see.
Yeah. Or I would have just said, well, that doesn't help us. The wall is still there.
Okay. And what just happened in here with your state of mind and your anxiety when you acknowledged this urge to?
So at a cognitive level, very low affect, but cognitive level, he's clear now on his state, the urge to be hurtful towards his mother, and I'm hoping that that's enough to give us an experiential differentiation between feeling, anxiety, and defense. But you'll see, it doesn't quite do the job. You'll see.
I don't think I understood, because he was quite mobilized after all this challenge and head-on collision, and why did you stop doing it? Because I felt like he was really close to having a breakthrough of feeling, so I'm not sure.
Yeah, well, he started stonewalling.
Mm-hmm.
There was this iron wall of defiance.
Yes.
And sometimes using interpretations is a way of softening resistance. Like there's different ways of dealing with resistance. Pressure and challenge are two of them, but interpretations are another. And especially earlier in Davinlu's work, he did a lot of that. It's not talked about that much, but it can be very powerful as a way of making his defiance ego-dystonic and helping him turn against it.
Okay.
Okay?
So it was important for you that he understands that he wants to hurt his mother? So does he... Was that the...
Yeah. Defiance. The major column of defense is defiance. Like earlier, like 15 minutes ago, I said to him, is it true that a part of you made a promise to yourself never to let anybody get close to you? Right? That hell freezes over before you let anybody get close. He said, yes, that's true. So I know that that defiance is a major feature of his defensive structure. Okay? And until we turn a corner on the defiance, pressure and challenge is only going to take us so far. Because then he can just defy my pressure and my challenge. So mobilizing the feelings, getting him mobilized so that the major column of defense could be fleshed out. And there he was, sitting there stonewalling me, defiant. So the pressure and challenge served its function. It fleshed out the major column of defense. And now we have to clarify that defense and help him turn against it, and then we can pressure and challenge some more. I'm hoping he's going to say his anxiety has gone down, because then we have the experiential differentiation. But we're not quite there.
Just picking up on what you were saying, so you're saying that pressure and challenge do some stuff, but then you had to go around the corner of defiance, and I was thinking, why not handle it with the head-on collisions?
That might have been a way to go. That could have worked, possibly. At this moment in time, a few years ago, this was my sense of the better way to go. Even with head-on collisions. I mean, if you're going to do a head-on collision, it requires that the patient can see the defense. The defense have to be fully ego-dystonic first and foremost. And doing a head-on collision can be a way of accomplishing that. So, possibly, yeah, that might have worked. Good thinking, good thought, worth considering. Thank you.
Johannes?
Yes?
Could you elaborate more about this, him willing to punish his mother, crippling himself, and is that connected to your intervention? So this is my question. The intervention is, so you want to yell at her because you want her to feel bad, to feel guilty.
Mm-hmm.
So you wanted to highlight this wheel of punishment in order to be able to connect that to punish through self-punishment.
Yes.
I think.
Yes. In other words, the only way he can get back at his mom is to be doing terrible in life. If he's doing well in life, she's going to feel good about herself. Like, I did a good job as a mom.
Yes.
And
Okay.
then what was that question, Johannes, when you said that when you spoke directly to the unconscious, was the phrase, why would you want to do that, or was it something?
Yeah, why do you want to do this to yourself?
Why do you want to do that?
Yeah.
Why would you want to do this to yourself?
Yeah. So it's pressure to the alliance, the unconscious alliance, to rise up and overtake the resistance. Like, I don't want to do this anymore. I'm sick of it, Dud. It fell flat. We're not there yet. Okay. Davenlu describes the unconscious therapeutic alliance in operation, the spontaneous sharing of meaningful memories and associations. So here we have the unconscious therapeutic alliance in operation. It's bringing up another memory.
Yeah, it went down.
We're starting to get there. An experiential differentiation is starting to happen, finally. He's clear that when he's actually feeling it, the sadistic impulse, he's not likely to lose control. But when he's tense and anxious, that's when he could lose control. So he's experientially beginning to differentiate this now. And it's critical. It's what I've been trying all along. It took until now. Maybe it would have been faster if I did it now. This was a few years ago. But we had to do that. We had to get this experiential differentiation. Or we have a misalliance.
Does he experience anger right now? Because I don't see it, because I don't see the face. And
Yeah. When he could feel that he wanted to call her a horrible person, at that moment he was in touch with his sadistic impulse to be hurtful. And then there was a drop of tension in his face. And I asked him, what just happened with your anxiety? He said it went down. Okay? So it wasn't a full-on unlocking, but it was a minor passage. It was enough of a passage of the sadistic impulse that we could have an experiential differentiation. And you saw how it went. I mean, I kept trying for that, and I kept trying for that. And he was too detached, or he was too overcome with guilt, conscious guilt. And I had the hardest time finding an inroad, and here finally it happens.
It's anxiety, right? And there he realized it because he actually experienced it within himself, correct?
Yes, experientially. It was not enough just to explain it to him. Oh, that's a temper tantrum, that's anxiety, that's not anger. That was a step in the right direction, but it was not enough.
Physically and cognitively, right?
For him to be clear that that feeling, him having his feelings isn't going to lead to acting out behavior.
Okay.
Explaining it was not enough.
Johannes, I have one question. So is this, so for people that have trouble accessing the anger, like there's no, like even if you do all the prepping or like they just can't picture ever doing anything violent, then being able to just yell or say whatever hurtful words, not just the yelling because that would be more of a whatever discharge, but for them to say or label horrible words, that would at least be a start to access some of that sadistic impulse that is so locked down, right?
Yes, it's some people call it a small victory.
Yeah.
It's even if you get to first base, to use a baseball analogy, I mean the home run is the unlocking of the unconscious, but sometimes the way to prep the ground and pave the way for the unlocking, you have to get to first base or you get to second base. You have minor little victories, little passages. Okay, so that they can begin to differentiate and to strengthen the conscious therapeutic alliance. So yes, absolutely.
And then obviously this depends on the skill of the clinician. I'm just a beginner. But is there ever a point when you realize a client could never, like if they can't access their anger, like what would they just can't even go there. They don't even want to. All they want to do is just tell the person what they did and not even call them names. If that's where they are, what would be your? I know this is a very big question.
Yeah, well, it's very case specific. Maybe for a specific client or patient, that's what they need to do. But I would want more clarity about exactly what they're hoping to get out of therapy. Like, were you hoping that I would encourage you to confront your mother? I mean, is that why you're here in therapy? Or
yeah.
I would just want to get really clear on exactly what they're wanting out of our work.
Okay.
Does that make sense?
Yeah.
Okay.
Yeah, it's very useful to see those intermediate bases.
Yes.
Because maybe it's not my idea currently, but in the past when I was approaching ISTDP, it was like the first impression was the or unlocking or die.
Right.
Or you're not doing anything.
Yes.
And so, yeah, we can see you can use a small portraits or small unlockings in the favor of the conscious therapeutic alliance and separating the triangle of conflict, anxiety, defense, and the impulse. It's very, very useful.
Oh, good. You nailed it. Exactly that. Good. You see how quickly he could access the murderous urge to strangle her as soon as the differentiation was in place. As soon as the experiential differentiation was in place, very easily he could get in touch with the urge to strangle her. That was the logjam all along. He really he really felt that to feel this would mean losing control. That's why it took so long, and that's why I was so meticulous and careful to make sure I achieved this experiential differentiation. It was the logjam all along.
Johannes?
Yeah?
What? I missed something. So what? You said, so this impulse is what makes you get, I can't remember. I missed something. Like,
Right, yeah, I know what you're referring to. I think. You tell me if I'm wrong. So, again, when he was in touch with shaking her, wanting to shake her, which again is a tactical defense, but it incorporates the aggressive impulse. So I went with it. I said, what just happened to your anxiety? And he said it went up. And then I said, so now we know what it is that makes you anxious. It's not your anger, it's what you want to do with your anger. It's the impulse.
that's the differentiation. So the fact that he got that gave you the green light to move towards portrayal.
The green light was a little bit earlier, Kelly. It was when he was in touch with wanting to call her a horrible person. And I asked him, what just happened to your anxiety? And he said it came down. And then I said, in what state of mind are you more likely to snap and lose control, right now or how you felt 10 minutes ago? And he said, how I felt 10 minutes ago. And he was clear that in his current state of mind, he was not likely to snap and lose control, even though he was experiencing this urge to be hurtful. That was the differentiation. You follow me?
Yeah, hold on, I'll find this real quick. You said, we can face the impulses so we don't have to be afraid of it.
Yeah, like it's this impulse to lash out. That's what you're fearful of. That's what gets you anxious. So if you don't want to spend the rest of your life afraid of yourself and your anger, we need to face that part of you so you can conquer that fear and no longer be fearful of your own impulses.
That's what it was. That's what it was. Like you helped him see that his fear of his impulse is what was holding him back. And so then that helped him cognitively understand why it's necessary to move in that direction then.
Well, experientially, he finally, experientially, he could see the difference between feeling something versus acting out.
Yes, okay.
It took a long time. Maybe I would have gotten there faster today. You know, this was a few years ago, but however long it takes is how long it takes. You have to cover those foundational pieces. Okay?
Okay. Thank you.
Sure.
I got a little confused on the same part because you said, so we know now that the right path to solve impulses is to resolve them so you don't feel physically or afraid of them. I kind of missed the last part of what you told them.
Yeah, so he goes, I want to shake her. What just happened to your anxiety? It went up. It went up. And I said, so now we know what makes you anxious. It's not the anger, it's what you want to do with your anger. It's the urge to lash out. And then I said, so if you don't want to spend the rest of your life anxious, afraid of your anger, we have to face those impulses so you're no longer afraid of them.
Okay.
Okay? Anya?
Johannes?
Yeah?
Lots of questions here, hey? So you've got me thinking about this because oftentimes, one of the skill building exercises that we learn is sort of, how does this anger go out towards this person if you let the anger do what you would never do, right? Which is sort of suggesting that the impulse, it's deriving from the anger, but it's sort of suggesting that the impulse is the anger. And I'm wondering if you could help me understand that differently, because I see here that you're differentiating between the feeling, like the energy inside you, that energy from the impulse.
Yeah, it's a good question. The distinction I'm making is between the physiological experience of the anger, feeling that heat and strength and power in your body.
Yeah.
That's not what he's afraid of.
But isn't this is a part of that?
Yes, it's part of the anger. So the anger has three components: the physiological experience of strength and power and heat, moving. That's the physiological, the neurobiological pathway. Then there's the cognitive component. I am angry. Okay?
Yeah.
And then there's the motoric component, the impulse, the urge to act, to be hurtful. And
Right, and I'm having a hard time separating when you have a retaliatory rage, that physiological experience in your body, it's doing this.
It's an outgrowth of that physiological experience, right? It's an extension of it. It flows from that physiological experience.
Mm-hmm.
But he's fearful of what he wants to do. That he wants to strangle his mother. I mean, the woman in the grocery store represents his mother.
Sure. Yeah. Okay.
Okay.
Okay. I think I'm in that better.
Okay. So we'll do a few more minutes, and then we'll have our little break, our 30-minute break. Yeah.
I have also a question.
Sure.
Sometimes when I try to do that with the experience the difference, let them experience the difference. Patients say, well, it depends on the amount of anger that I feel. So they would say, if the anger is higher, that's when I lash out. So how would you have what would you have said if he said like, okay, I see the difference, but if I'm getting more angry, that's when I lash out. So
yes.
Understand what I want to say?
Yes, I do.
An amount of intensity of feeling.
I understand, Anya. I understand. Yeah, it's the same thing. If the patient says, if the anger gets more intense, that's when I might lash out, they're still confused about the corners of the triangle of conflict.
Yeah.
There's still the enmeshment where the corners are mushed together. So if someone is really clear that anger is calm and powerful, but it has nothing at all to do with being out of control, then it doesn't matter how intense that anger gets. They're not going to confuse anger with acting out. So
so that means that they still didn't get the difference.
Yeah. You still have to do more work on the differentiation of the corners of the triangle of conflict.
Okay.
Okay. Sure. Go.
Yeah, Johannes.
Go for it.
Johannes, and then I'm realizing that what we saw before was an healthy resistance, because of course he was trying not to act out. So it was, in a sense, it was healthy.
Mm-hmm.
And if you would have skipped this differentiation and he would have gone for an unlocking, probably he would have, complied, probably.
Yeah, complied and then secretly defied.
That if you skipped that, you would have pushed for his compliance.
Yes, I agree with you. And underneath that, defiance. And yeah, it's like I said in my introductory remarks. I could have pushed, and I might have gotten lucky and gotten an unlocking, but those kinds of unlockings aren't that healing as far as I'm concerned. Okay, so it's much better to create this proper foundation, to get all the foundational elements in place. Once that's there, boom, you have a green light. You can go, and you'll see that this initial 3-hour session is now coming to a close. And so when we get back from our quote-unquote lunch break, we'll see the 12th session, and you'll see how different I work with him at that point.
Yes.
Okay. I just had a question about the anger, Johannes.
Sure.
You said that anger normally is calm and powerful, but at the same time, true anger normally does have an impulse, right? So then is true anger supposed to be calm and powerful, knowing that there is an impulse, but having the, I don't know if it's ego strength or whatever, to be able to just manage it and knowing that that's just an impulse, I'm not going to do it, and stay calm and powerful. Is that what?
Yeah.
Just find a way to either, if there's a solution to be able to do this, whether it's tell the coworker how much you're annoyed or whatever.
Yeah.
Because it does still, right? So healthy anger it's calm and powerful as long as you stay in control of whether you're going to act out or not, right? Even though it is associated with an urge, if you could, whether a realistic one or a imaginary one that you do on your own.
Yeah, so optimally, without anxiety and defense, with just the anger, you're going to feel it in your body. You're going to feel the strength and heat and power. You're going to be aware of some sort of urge to be hurtful in one form or fashion. And you're going to know, I'm angry. And if you can feel that, all the anxiety is going to go away. It's like it just drains, leaves your body. There's no anxiety. And you're going to be thinking really clearly. And you'll have access to all your executive functions, all your internal resources. And then you can be assertive and decisive and stand up for yourself or do whatever you got to do. But it requires feeling all those three components of the anger and rage. Then your anxiety goes down and you can be assertive at that point. Okay?
Or you can choose not to be assertive, right?
Well, yeah,
You
whatever.
choose,
I mean,
hey,
yeah, whatever's in your best interest.
Okay.
Yeah.
So,
Tomorrow.
Johannes, so then you have to still allow yourself to experience it in a physiological way and be aware of what's going on inside your body, and then cognizant that that's what's going on, and not act on the physical impulse to actually hurt someone. But you can imagine it within yourself and experience it within yourself, and that's how you deal with the anger part, right?
Yeah. So it helps when you have to sort of have the therapy.
I mean, at least myself, because it is.
I gotcha. So it's getting your own therapy is what's going to help with that part of it. And then with your patient, in order for it not to just be an intellectual exercise, you have to do enough work on the defenses. But I agree with you. If you haven't had this kind of therapy yourself, super difficult, because these things aren't really sorted out within your own heart and mind. So it's going to be super difficult. I totally get that. Stooped to our level and helped us process these feelings at an early age. But most of us didn't have parents like that. So here's the thing. We are at the 3-hour mark. And so should we take a 30-minute break and then come back and see the rest of the treatment? Does that seem like a good idea? I can field some more questions or comments. I'm getting some thumbs up. Okay.